welcome back to the Medigap Show. I'm your host, Holly Cohen, licensed agent and founder of medigapcares.org, where you can go right on there and book a free appointment with either me or an experienced member of my team. We're happy to answer any questions that you have. So when you first begin on Medicare, you have two choices for your coverage options. We're going to explore these options and also discuss an important aspect of one of the options, which is to use AI and algorithms to predict decision-making for Medicare Advantage plans. When you become eligible for Medicare, you have two choices. Option number one is Original Medicare, which includes Part A for your hospital coverage and Part B for your outpatient medical coverage. You have the flexibility to add a Medigap plan to fill in the 20% not paid by Original Medicare and also some of the deductibles of Original Medicare. Option two is Medicare Advantage. So this involves enrolling in a private insurance plan, often an HMO or a PPO plan. Today, our focus is on Medicare Advantage plans and the use of AI algorithms in their healthcare decision-making process. It's really important to understand that AI and prior authorization processes only apply to the Medicare Advantage plan world and not to Original Medicare and Medigap plans. The first article from Stat News dated July 11th, 2023,
how the insurer's acquisition of a popular Medicare Advantage algorithm sparked internal dissent over denied care.
Frustration was boiling into open conflict within NavaHealth, a company that uses computer predictions to help control the cost of caring for millions of older and disabled Americans on privatized Medicare plans, which is Medicare Advantage. The source of the outrage was not a customer or a salesperson, but an algorithm, specifically one that was being used to predict the amount of care needed by seriously ill patients. In 2021, employees raised alarms that efforts to bypass the algorithm and pay for longer rehab stays were getting slapped down at higher levels of the organization. Multiple cases involved patients who were still so sick they needed daily infusions to treat infections. It's still happening, one employee complained in an internal communications obtained by Stat. Another added, I had one that I had to communicate 2 times that was an IV and very clear on the continued stay, and it was still denied. NavaHealth managers have said the algorithm is not used to make coverage determinations. In a statement, the company repeated what it told Stat in March. The tool is used as a guide to help us inform providers, families, and other caregivers about what sort of assistance and care the patient may need, both in the facility and after returning home. Coverage decisions are based on Centers for Medicare and Medicaid Services coverage criteria and the terms of the member's plan. That was the quote by the NavaHealth managers. But a deeper look inside NavaHealth reveals the algorithm is in fact a focal point for determining coverage. It puts the process in motion, sets the deadline for coverage decisions, and provides information that can influence the outcome. In some cases, the algorithm was used in coverage decisions that may violate Medicare's rules, which are designed to protect the safety and dignity of beneficiaries. The investigation revealed that even in instances when staffers argued that patients needed more time in rehab, NavaHealth's physician medical reviewers deferred to the algorithm, fueling internal dissent that the denials were inappropriate and contrary to clear medical evidence. But the concerns voiced by NavaHealth's former employees echo the experience of family members on the receiving end of the denials. People forced to watch their loved ones suffer after being cut off from care prematurely. I felt like we were targeted, said Gloria Bent, 78, the widow of Gary Bent, a retired physics professor at the University of Connecticut, who needed rehab care after undergoing brain surgery to remove a cancerous lesion. She said she successfully appealed 2 of NavaHealth's attempts to cut off payment for her husband's stay in a skilled nursing facility in July of 2022, but the company's third denial stuck, and her husband was sent home with a fever and throbbing pain in his head and neck. She gave him Tylenol and tried to keep him comfortable. But the next morning, we could not rouse him, Ben said. When we were able to rouse him, he did not know who he was, where he was, or who I was. She called for emergency help, and her husband was taken to a hospital where he spent 3 weeks recovering from bacterial meningitis. He died in March 2023 at age 82.
This sheds light on how certain insurance carriers managing these Medicare Advantage plans have turned to AI to make coverage decisions. According to the article, this algorithm analyzes vast amounts of medical data to determine which treatment will be approved or denied for Medicare beneficiaries. However, it has raised concerns about prioritizing cost savings over a patient's well-being, potentially leading to suboptimal care for some beneficiaries. The second article from Stat News, dated July 24th, 2023, highlights a lawsuit filed against another insurance carrier regarding claim denials for Medicare Advantage beneficiaries. Allegedly, the use of an algorithm contributed to the rejection of certain treatment requests. In this case, the decisions on treatment approval were made without the review of human eyes, relying solely on AI algorithms. The lawsuit raises questions about the fairness and accountability of such decisions using AI for our healthcare. The next article also echoes the concern of the potential prior authorization over a patient's well-being by using AI and algorithms in determining whether someone would be approved or denied for medical treatment. Unlike original Medicare and Medigap, where decisions are based on medical necessity, you have the freedom on original Medicare and Medigap to choose any doctor, any hospitals. Rather than when you're on Medicare Advantage and you have no options, you leave your health to the fate of a private insurance company that may not be looking out for your health as their best interest, but for profit. This article highlights a specific case involving an insurance carrier, a major health insurer, and their handling of medical insurance claims. It reveals how the insurance carrier used an algorithm to automatically deny or delay certain health insurance claims, potentially leaving beneficiaries without the essential medical coverage. The use of AI and algorithms in healthcare decisions has raised serious concerns about the erosion of human oversight. While algorithms can process vast amounts of data, they may not account for unique individual circumstances that a human reviewer could consider. The implications of relying solely on AI and algorithms in Medicare Advantage plans can impact your access to necessary treatments and potentially jeopardize your health and well-being. As you weigh your Medicare options, consider the pros and cons of original Medicare with a Medigap plan, which prioritizes your well-being and puts you in control of your health care, versus Medicare Advantage, where you are leaving it up to a private insurance company to make decisions on your health care. Now, I ask each and every one of you watching this video to help us spread the word. Please like and subscribe to our channel and share this video with your friends, family, and anyone else who can benefit from this information. Together, let's empower Medicare beneficiaries with the knowledge they need to make informed decisions about their Medicare coverage. I've included links to the articles I've discussed in my description below. Feel free to explore them to further understand the concerns and the challenges surrounding the use of AI in Medicare Advantage plans. Together, let's stand up for the integrity of our Medicare decisions and prioritize patient well-being over profits. Original Medicare and Medigap plans have stood the test of time, providing reliable and comprehensive coverage for countless Medicare beneficiaries across the nation. Thank you all for joining me today on Medigap Show. I hope this information has provided valuable insights into the choices you have when it comes to Medicare coverage and the implications of AI in Medicare Advantage plans. Please remember to like and subscribe and share this video with your fellow Medicare beneficiaries and friends. Together, we can make a difference in our Medicare and ensure that everyone has access to the best care possible. That's all for now. I'll see you next time on the next episode of Medigap Show. Be well.